The coronavirus pandemic has become the defining global crisis in our time and the greatest challenge the world has faced since World War II. Unfortunately, this disease has no cure, and the second wave of the pandemic is a reminder that it will be around for the foreseeable future as people are still being infected and are dying from it. Available statistics show that as at yesterday, 25th January 2021, Nigeria has 122,996 confirmed cases of COVID-19. 23,130 active cases, while 98,359 treated and discharged patients have been recorded, while we have 1,507 deaths on record too. Now, due to huge negative impact on the economy, a second lockdown seems to be most unlikely as a means of curbing the spread of the virus. As an alternative, the Presidential Task Force on COVID-19 (PTF) has continuously advocated compliance to safety protocols, while various enforcement units have been going around monitoring the level of compliance. However, the level of complacency observed in most public spaces is alarming, especially in schools, markets and commercial vehicles where there is no recourse to social distancing and proper wearing of a face mask. This surely portends an unhealthy trend for the society. Now, what are the implications of flouting the safety protocols? What are the challenges with enforcing compliance? These are some of the questions we'll be seeking answers to on this edition of the program, Nigeria Today. Welcome. This is NTA News 24. I am Musba and Wahab. Now in the studio to discuss COVID-19 enforcement of safety protocols is Dr. Mukhtar Mohammed. Is the National Incident Manager, Presidential Task Force on COVID-19. Welcome, Doctor.
Good evening. Welcome. Thank you.
All right, good to have you. Now, with all the enlightenment campaigns around going out there, you still find a large number of people who are not complying with the use of face mask protocols. That's to start with the least. Are the people getting tired or simply lawless about this?
It's really a source of worry to PTF. We have made a lot of sensitization, communication, provided awareness programs, but you are right, people are really complacent. We know that it is uncomfortable for people to change from their normal behavior, but the most important thing is, we want to survive, we want to protect ourselves, we want to protect our loved ones, and therefore it's important that we try to adhere to these protocols. People have not been compliant as much as we would want them to, and therefore the number of infections, as we have seen, have continued to rise. One of the reasons that we know is responsible for the increase in number of cases, or this second wave, is because people have continued to go about their business as normal. They continue to have their gatherings. They don't mind going into places that are congested. People do not care to protect themselves by wearing face masks or to ensure social distancing. So these are really the issues that we need to address and tackle. And therefore, like you said, we may have to resort to enforcement to ensure compliance.
All right, before we talk about how to intensify the enforcement and enlightenment campaign, what are other implications of these since people have refused to comply with all of these protocols, talking about social distancing and then use of face masks? What are the implications on the society?
So the implication is that if you continue to interact with other people without due consideration of the protocol, is you make yourself vulnerable to catching COVID-19 infection. Most of the people that will catch the infection actually may not even show symptoms. but they can spread that infection to other people. They can spread it to their children, to their family members, to their loved ones, or to their parents. And the danger is where you have people who are vulnerable, or those who have underlying conditions, or they are vulnerable to getting the disease more, or to manifest the disease. They become ill. Some of them become critically ill, and some of them may actually even lose their lives. So this act itself, propagates the epidemic, makes it grow and infect other people, and will continue to have rising cases. So rising cases also have an impact on our health facility, on our healthcare system, on the health of our population, and also even on the economy.
All right, Doctor, you just talked about the fact that some people are asymptomatic and they don't show signs when they're even infected. And yet, we have places around us whereby you see people mingling, a large number of people, and we don't get to hear much about infection rates coming from this part of the country. Does it mean that these people are having a very strong immune system, and like people already say that Africans are a special breed? What about this?
Well, I don't want to go that line. I would rather say that, if you continue to interact with people, as long as there is COVID-19 in that community or in that location, the likelihood is that it is going to propagate. We are seeing the second wave. It is much more vigorous than the previous wave that we had seen last year, and this is because largely we are not observing these protocols. We continue to have our parties, we continue to have our markets. People attend markets from everywhere without really following this protocol. A lot of effort is being done. Some try to take care of themselves, but a lot of other people do not do so. Now, if you look at our statistics in the country, you realize that it is mostly the urban areas. This infection is imported into the country. It's not something that started indigenous. So initially it started with cities that had airport. If you remember, it was Ogun or Lagos first. Ogun is very close to Lagos. So Lagos became the epicenter of the epidemic. Closely followed by Lagos is Abuja. And then we saw Kano and we saw Port Harcourt. So these are the areas where, the external passengers or people who travel from outside the country came and saw the seeds of this epidemic, and from there the epidemics continued to propagate. Gradually now the infection is reaching the suburban areas and even going to the rural areas. So it spreads very slowly but surely, as long as we continue to interact without any consideration for the precautions and the COVID-19 protocol.
All right, you just reminded Nigerians that this disease was imported, rightly so. Now, we're talking about community spread, and yet it's still being compounded by importation still, because we still have a lot of people still coming into the country. We're aware that you have some arrangements in place for people to test on arrival, but then do you think the level of compliance we have is enough to curtail this importation again? Because we still have some people registering before coming into the country for test on arrival, yet they don't go for such test.
So absolutely, we have instituted a very rigorous process, a process that will ensure that we prevent at least 98% of potential infections, to be imported into Nigeria. What is the process? The process is that before you leave the country where you are departing, before you come to Nigeria, at least 96 hours before departing, you must have a negative COVID-19 result, and it has to be PCR based. So that will assure us that at least at the time someone did that test, he is unlikely to be COVID-19 positive. So you can say that people coming into Nigeria already have they tested negative, at least that 96 hours before arrival. Now, once they arrive, we require them to also complete our health screening questionnaire. This health screening questionnaire asks about history of cough, fever, cold, contact with people who had COVID-19, so at least we know, from that history whether they have had these contacts in the last 2 or 3 days, that is after they did the testing. On arrival, they are supposed to go into isolation. They are not supposed to mingle with other people until they carry out another PCR test on day 7. So when that result comes out and they are negative, now they are free to interact with other people. You talked about compliance. Yes, when we instituted these measures initially, I will tell you about 50% of Nigerians just think that maybe we are doing it, for doing sake, or maybe we wanted them to just pay for the tests, until we started enforcement. About a couple of weeks ago, the PTF announced, the suspension of about 100 passports of people who refused to do the day 7 testing. And since then, we have seen the level of compliance has increased. Nearly all of them that have missed, that test came back that they now want to be tested. So when you have punitive measures, I think people understand that more. When they understand that there are repercussions, I think people comply more. But really, we don't want to reach that stage in the general public. People should actually take responsibility as we keep encouraging, because it is about ourselves, and it's about our family, and about our community.
Well, thank you a lot, Doctor. Now, let me bring you to a situation we had recently. Personally, I'm aware of what happened, and 2 Nigerians traveled to a neighboring country, tested before leaving this country with a certificate, and getting to the other country, they were tested positive again. What do you think is responsible for this? Or is it because of integrity of the tests we have in the country, or what could be responsible?
A lot of factors could be responsible. Number one, let me assure Nigerians that our accredited laboratories are actually very good. They are one of the best, and we ensure quality control in the testing that they provide. But however, we know that there are elements, who are not really so credible. People who do some nefarious things, to sabotage government, providing fake results. So all those things have been reported. We actually carried out a sting operation, and we arrested a couple of people, who were involved in that process. So the Nigerians that were reported to have had positive result, I think in a few countries, is largely, because either they fell into these nefarious hands, or perhaps they were within a window period. And we have seen that also here. People that are coming, we found a few that tested positive, even though they had a negative result. So it's about the normal process of having some incubation period within which someone may not actually expressly show a positive test until after a few hours later. So that is possible.
Thank you very much, Dr. Mokhtar Mohammed. Let's quickly take a break. We have more to talk about on Nigeria Today in just a moment.
The awareness has not gone to the grassroots. That is the way I look at it. I think the National Orientation Agency has a lot to do in this aspect, because most people believe there is no COVID-19. But with all what we've been hearing, even in and outside Nigeria, there's a proof that COVID-19 is real. Federal government said we should do this in line with Roman 13. You understand? That is why I have my own here. You understand? I have this because I don't look at it for me to disobey government law. If not, myself personally, I don't believe that COVID-19 is a sickness that will kill me.
What I would advise to the government should do more enlightenment. People, some of us are here, they're observing it, but the government, I'm advising government to do more enlightenment.
People believe that COVID-19 is not real. Others believe that it's not so effective as the what they call NCDC have said it to be. That it's not so effective. And other people believe that our weather, even though there will be COVID-19, our weather has reduced the power.
You're talking about COVID, everybody stay at home, stay safe, distance yourself, and you're still telling them, go back, go and link your SIM with your NIN, or your land will be banned. You're definitely causing crowd, and so who do you want to sanction?
All right, who do you want to sanction? Dr. Mukhtar and the new guest just joining me. That's Iharo Atta. We answer some questions from that Vox Pop we had in the city of Abuja. And Dr. Mukhtar, you just listened to a cross-section of Nigerians raising some very important issues there. What do you say to this? Who do you want to sanction?
Well, I think people have expressed their views, and they're very sincere, and I think they're very germane, and we need to look into these issues. Regarding the last comment on the national identity registration,
right.
And also complying with the protocol, we have received many reports that these centers do not comply with the protocol, that the activity should be suspended, that the organization is not so good. So what we did from the PTF was we contacted the Ministry of Communications and really informed them that these activities are violating the protocol, and that they need to ensure that these providers comply with the protocol, to make sure that it is done in an open space, to make sure that the seating arrangement respects social distancing, to ensure that everyone who is in that spot uses a face mask, and to ensure that there are hand washing facilities and people use sanitizers as well. Because of the short notice, I would say, or the short time that is required for people to do this, certainly people get agitated and people go out in troops and in crowds. So we call on the telecommunication companies to provide more centers that can conduct this activity, and also to ensure that they comply with the protocol in these places.
Thank you, Doctor. Now, let me quickly bring in Iharo Atta, Head of Media and Enlightenment, FCT Enforcement Task Force in COVID-19. Thanks a lot for joining us, Iharo.
Thank you very much for having me on the show this evening.
All right, now, you just joined when a lot of Nigeria, or some Nigerians have been raising concerns about this second wave of COVID-19. Dr. Mukhtar Mohammed has been talking about that too. And we've seen a lot of enlightenment on the media and what you have been doing within the FCT too. Why do you think we're still having this level of non-compliance from the people?
I think if you look at it here, the issue of non-compliance is very, very worrisome, and we must all admit that going forward as a people and as a nation. One, as I said before when I was on the program, thanks, you are the one who anchored me, and Dr. Mukhtar would have also accepted. Some prominent religious clerics from both monotheistic faith had come forward to say COVID-19 is not real. Some said COVID-19 is a new world order, trying to reconfigure our genotype against what God wants us to believe. Some said it's about the apocalyptic mark of the beast that is fulfilling here. I think in all of these, some of those prominent clerics who have come forward to speak against COVID-19 have really punctured the soul of many. And if you look at the Vox Pop that was done here, some believe that it may likely not be affecting us because of our weather and whatever here. And I think I disagree with the first man who says we have not done enough advocacy. We've done intensive and enough advocacy going forward here. Your program in the past 3, 4, 5, 6 weeks have been on COVID-19. If you watch NTA and other stations, it has been on COVID-19. I think the issue on ground is that we need to do what we had to do as a government. Sadly, some persons have already engaged in misinformation and disinformation here, but I think we are pushing forward and we should push forward. And what I told people when I go out on enforcement, we will save them against themselves.
All right, thanks a lot, Tata. Now that you have also pointed out another important issue, talking about the religious perspectives to it. What do you suggest should be the way out now? How do you think PTF should intensify or new protocols to ensure that people really comply with this?
Yeah, like what Dr. Mukhtar raised, we must be bold to actually tell our people the truth. We must be bold to stand for what we believe is right and the conviction that we hold as a people and as a government here. Enforcement is very key. Enforcement is cardinal at this point, having gone through intense advocacy. Dr. Mukhtar, as well as Dr. Sani Aliu and the SGF, Boss Mustafa, always engage in media briefing to keep Nigerians abreast here. We must start to ensure that we deeply enforce compliance here. We in the FCT, we are doing that, and we are planning very strongly from next week. From next week, we are going to increase the bite, because the bite have not been at what we expected. We are seeing reduced use of face masks, like what we saw the last week here. We are seeing persons trying to go back and relax against the COVID-19 protocols given by the PTF. We are not going to be allowing that here. There will be enough hue and cry, but in all of this here, we will ensure, even some vehicles are carrying 2 in front, with the passengers making 3 or 4 in front. All of this will push and push real hard. We've told the teachers when we went to school that some of the teachers are not complying. The students are heavily complying, and we are going to be going that. But at any point, we may even need to pick up some teachers to take to the mobile court so that they will face the full rod of justice, because you can't be a teacher in a school. Your kids are all complying, those students are complying, and you, the teacher who is supposed to be the lead, is not complying. I think enforcement is very key here. The first time during the first wave, when we go out, we pick up some clerics, both from some mosques and some churches here. People raised doors, but we told them that it's our duty as a government to ensure that people comply and do what will make them safe. And I think that is appropriate and what we all should be doing going forward.
All right, thank you very much, Hirata. Before I let you go, because I really appreciate your effort to ensure that you joined us. Now, you mentioned the fact that you're going to bite more in coming days and that people should expect stiffer penalties. How do you intend to go about this?
What we need to do is to really tighten the grip on the city when it comes to COVID-19 compliance here. We agree that the compliance is very high at the city center, somewhat at the satellite town is a little bit average and going down. At the interior of some parts is very, very low. So the areas where we have it complying, we boost up those areas here, because if you watch people now today, I went around on surveillance, even I'm currently on surveillance now in my car. I'm seeing people who are just coming back from work, where I pinned down here. I've gone to Lucia Lahaji, I'm coming down to around AYA Kubo. Some buses fully overloaded with passengers just going home, some even standing, not having face masks. The other speaker talk about the NIM center. Those centers, with due apology, are super spreaders. I've been to the one in Kuba, been to the one in Karu, and some other area, even in Karishi. They are super spreaders here. And from my perspective, and from my point of view very strongly here, those centers need to be shut down if we are really committed to that. And I'll be pushing that forward here by making my report to the FCT minister. The NIM center, if you go there and you see what happens there, people come with face masks. When they stand and they can no longer breathe freely and they want oxygen, they pull the mask down. When issues come up of allegation and bribery and all the complaint there, they even throw the mask off. I think it is apt when people are working very hard in the PTF throughout the night here. We must do all we feel is appropriate to actually keep ourselves safe and keep the city and Nigerians on safe hand while we go through COVID-19 pandemic.
All right, thanks a lot for joining us, for making our time to join us on the program. I will allow you to go and continue with your surveillance tonight. Thanks a lot.
Thank you very much, my brother. I'm indeed happy to be here.
All right, now back to you, Dr. Mukhtar Mohammed in the studio. Quickly, let's have in the form of your last words on the program, how is the PTF interfacing with various state governments on enforcement of safety protocols? In 30 seconds, please.
Okay, so while I appreciate my brother for all the good work they are doing in FCT, we at the PTF, we are working with the state governors. We have got them to sign what we call the Health Protection Law, which has been submitted to Mr. President for his accent. Once Mr. President signs this accent, it empowers both the federal government and the state government to carry out enforcement, carry out surveillance, and also prosecute people. We will have mobile courts, and people can be charged fines and prosecuted up to maybe even 6 months in imprisonment. So that is going to come in the coming days because we need these sticks to ensure that people do comply.
All right, Dr. Mukhtar Mohammed, National Incident Manager, Presidential Task Force on COVID-19. We really appreciate your time and perspective on the program.
Thanks for having me.
All right, that's Nigeria Today for today. The program returns tomorrow. Join us for another package. Be sure always watch this edition or other editions on youtube.com/NTA News 24 Hub. I am Musbad and we'll have stay well.